In this video on autonomic pharmacology, we will first deal with the basic anatomy, then we will discuss the cholinergic and adrenergic transmission, and at the last we will discuss the cholinereceptors and adrenoreceptors. So let's start the video with the basic information. We all know that our ANS, autonomic nervous system, is composed of two portions. One is the motor efferent portion and other is the sensory afferent portion. In pharmacology, we are mostly concerned with the motor and efferent portion. Okay, so this portion is responsible for the transmission of important information from the CNS to the involuntary organs. And here, involuntary organs are our heart, the blood vessels, smooth muscles of the blood vessels, smooth muscles of different viscera, and exocrine glands. This system is composed of sympathetic autonomic nervous system, parasympathetic autonomic nervous system, and enteric autonomic nervous system. The fibers for the sympathetic autonomic nervous system, they originate from the thoracic and lumbar segments of the spinal cord. The fibers of the parasympathetic autonomic nervous system, they actually originate from the cranial nerve nuclei that includes our nerves 3, 7, 9, and 10. Whereas the ganglions of the enteric autonomic nervous system, they are present in the myenteric plexus and the mesenteric plexus. This mesenteric plexus is present in the submucosa, whereas the myenteric plexus is present between the two layers of smooth muscles, circular and longitudinal. Okay, next is the location of the ganglions in these systems. In the PNS, the ganglions are located in the organ that is innervated. So the preganglionic fiber is large, whereas the postganglionic fiber is small. Whereas in case of the sympathetic autonomic nervous system, the ganglia are mostly paravertebral, whereas some are prevertebral. Here the preganglionic fiber is small, whereas the postganglionic neuron here is large. Okay. One important point here is the fibers which originate from the sacral segments of the spinal cord. Traditionally, they have been included in the parasympathetic autonomic nervous system, but the recent research indicates that they are sympathetic cholinergic fibers. So, if this is confirmed, then they must be included in the sympathetic autonomic nervous system category. Okay, now let's move towards our cholinergic transmission. So, where cholinergic transmission actually occurs? It occurs in all ganglia of the ANS, at the junction of the adrenal medulla, okay, NMJ, neuromuscular junctions, then the sweat glands, they are innervated by the sympathetic system, but the neurotransmitter there is acetylcholine. Next are the postganglion parasympathetic fibers. Okay, now let's deal with the synthesis. So acetyl-CoA, it comes from the mitochondria, and the choline actually it crosses the membrane, and this is the rate limiting step, and this step is inhibited by the drug hemicolinium, but this is only used for the research purposes. Okay, they both combine, resulting in the formation of acetylcholine. Then a transporter, that it is known as vesicle associated transporter, it transports the acetylcholine in the vesicles. Here this step is inhibited by vasamicol, and this drug is also used only for the research purposes. Next is the release. So release occurs by the interaction of snare proteins. Okay, so these snare proteins, they are present in both the vesicles and the synapse membrane. One that are present in the vesicle, they are known as VAMPs, where the one that are present in the synaptic membrane, they are known as synapse. Okay, so VAMPs are synaptobravin, synaptotagmin, whereas SNAPs include SNAP25, syntaxin. Okay, the important point here is that first interaction of these occurs, the vesicles, they move closer towards the synaptic membrane, then there is entry of calcium ions, and then these vesicles, they attach with this membrane and they open up, resulting in the release of the neurotransmitter. That's the important point here. And botulinum toxin, it actually alters this synaptobravin or other synapse proteins. As a result, there is no release of acetylcholine, and it's used in the Botox injections. Okay, next is the metabolism. Here, important point is acetylcholine esterase, this enzyme. This esterase enzyme, it breaks the acetylcholine into acetyl-CoA and choline, and they are recycled back. And this enzyme, it is present in the postsynaptic membrane, and it acts extracellularly. Okay, all the drugs that are mentioned in the release, in the accumulation of the drug in the vesicles, they are only used for the research purposes. They are not used commonly, but this botulinum toxin, it is used. Now let's talk about the adrenergic transmission. This transmission occurs in the postganglionic sympathetic fibers. Two exceptions are present. One I have already discussed, that is of the sweat gland, and another is the vasodilator fibers to the blood vessels of the skeletal muscles. Here, the supply is sympathetic, but the neurotransmitter is acetylcholine. Now let's talk about the synthesis. So the tyrosine is acted upon by the tyrosine hydroxylase and it is converted into the dopa. The dopa is converted into dopamine and then dopamine is converted into norepinephrine. And this last reaction it occurs in the vesicle. The dopamine it enters in the vesicle by the help of this transporter and this is inhibited by reserpine. Next, we have another drug that is metyrosine and it acts on the tyrosine hydroxylase and this is a late limiting reaction. On mitochondria, we have monoamine oxidase and it metabolizes this dopamine and norepinephrine. As a result, their level decreases. But if the inhibitors are given, then monoamine inhibitors are given, then their levels will increase. So now let's talk about the metabolism. It is different from the acetylcholine in a sense, like the NET, norepinephrine transporter, and this DAT, they actually transports the drug back inside the neuron. Okay, and the drug which is present in the cleft, or the drug or the endogenous particles that are present in the cleft, they are taken up by NET and DAT and recycled back into the neuron. But if the drug or the endogenous compounds they are present outside the clefts, then they are metabolized by MAO and COMT, and as a result their products are formed, and we can check how much amount of norepinephrine or epinephrine are formed by the measurements of those products that includes metanephrine. Here is a primary neuron, and suppose this secretes acetylcholine, and its vesicles they mostly contain acetylcholine, but some other transmitters are also present. So they can be neurotensin, they can be substance P, they can be enkephalin, they can be present in the same vesicle, primary vesicle, or they can be present in the separate vesicle as well. So this is all about the core transmitters. Next, and their purpose is modulation of synaptic transmission, and we all know this is just a simple basic concept. Next is the ANS receptors. So we have two major categories. One is the cholinergic and other are the adrenoreceptors. These are the receptors of parasympathetic nervous system and they are of the sympathetic nervous system. These cholinergic they are further of two types, muscarinic and nicotinic. The muscarinic we have five, M1, M2, M3, M4, M5, and this is the signaling mechanism by which they work. Like the M1, they work by GQ coupled protein. The M2, they work with the G inhibitory proteins, and then the same QI. Okay, the first three are most important here, but the 4 and 5 they are also present in the brain. Next, we have nicotinic that includes NN and NM. The NM they are present in the neuromuscular junctions, whereas the NN they are present in the ganglion or of the ANS. Next, we have the adrenoreceptors. We have two basic categories. One is the alpha, other is the beta receptors. Alpha are further divided into alpha 1, alpha 2. The alpha 1 they signal through the GQ proteins, whereas the alpha 2 they work by the GI inhibitory proteins. The beta receptors, we have three beta receptors and they all work by GS. Next, the dopamine receptors, they are actually a subcategory of adrenoreceptors, and we have five, but we mostly deal with the in the periphery with the D1 receptors, whereas the D2 they are mostly present on the presynaptic neuron and they all are present in the CNS. Next is the dual organ innervation. So suppose the SA node of the heart, it has both innervation, vagus, which provides the parasympathetic innervation, and the beta receptors, which provide the sympathetic innervation. So the dominant system here is the parasympathetic nervous system. So if a ganglion blocker is given, then the system that is mostly inhibited will be the dominated one, and the effects of the non-dominant system will be unmasked. Okay, so that's all about the basic anatomy, cholinergic and adrenergic transmission, and the receptors. We will discuss the whole transmissions in detail and the receptors in detail in the coming videos. So if you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video. Click on the bell icon to stay connected.